All right, ma'am. So what you have is called a bunion. A bunion is something that you're not born with, but you're born with foot types that predispose you to that. They're not caused by shoes, but they are aggravated by shoes. Chances are someone in your family has this, a parent, a grandparent, an aunt or uncle, somebody passed this down to you. Bunions are very common with people who have very high arches or cavus foot types, and bunions are also very common with people who have flat feet. Bunions are also common with people who have certain types of arthritic disorders, such as rheumatoid arthritis. But what happens in a bunion is the long bone in the foot, the first metatarsal, instead of being in a straight position, kind of shifts outward, and then the big toe goes inward. What you start to have is the prominence of the first metatarsal head in this region. If you wear shoes that are going to compress your foot like this, the bunion can become very red and become very painful. If you look at your foot, you have a very narrow heel and a wide forefoot. The wide forefoot is because of the bunion. And so people don't buy shoes that will slip on the heel too often because it's too uncomfortable to walk that way. So they'll buy a narrower shoe that will actually aggravate the bunion itself. So the big toe should be over like this, and there should be no bump in this area. Once the big toe starts to migrate towards the little toe, it hits the second toe, and it's like the domino effect. The second toe is obviously smaller, so it starts to move out of the way. And in severe bunions, we've had patients where the big toe is actually touching the fourth toe. That's how severe they get.